Hello everybody, this is Dr. Tyler Evans from Arete Chiropractic coming at you live today with the Facebook Live Research Moment. And today we are talking about the neck-tongue syndrome and what is that? Why can chiropractic help with that? Well, there is a problem that can arise when the upper neck gets positioned out of alignment when there's been trauma, either from a car accident, from maybe birth trauma, maybe even from sitting at improper positions for long periods of time. But the neck gets locked out of position. It looks something like this. We call it upper cervical misalignment, where the base of the skull here and C1, the first cervical vertebra, and the second bone down get locked out of position. So you can actually see the difference in the rotation there at C1 and C2, and there's no disc above or below that joint. So what can happen is it gets locked out, and it can start to cause a whole host of problems. We call that upper cervical misalignment. And what that can result in is this problem called neck-tongue syndrome. It's a rare thing. I've seen it a few times in practice, and generally those patients respond really well to upper cervical corrections. But this paper here is called neck-tongue syndrome. It's a case report by these doctors here in Hong Kong who do manipulation to the spine, and so they actually had great results with this patient. It was a 43-year-old male, I believe, that he was under care for just a few weeks and saw great results, nearly full resolution. After I believe it was 3 months, he had a full resolution, no symptoms after 3 months, which was really astounding considering a lot of the other modalities and results that can happen there. So what is it? Neck-tongue syndrome. So when that upper neck locks out, it can affect the C2 dorsal nerve root. So the nerve root that comes out of C2 down here, it actually comes up and wraps around the head and can even go into the face, but it's this guy right here. So the green one right here, and so you'll see this pattern. This green area is where the nerves will be most affected. So there will be pain pattern on one side, as well as that side of the face and the tongue will be affected, and a weakness will happen where the tongue will actually lock over because of it's called the trigeminal cervical nucleus will push nerve input up into the brainstem and actually affect how the face and the jaw and the tongue is working, and it will lock the tongue over because the nerves are all connected to the neck. And so if that neck is locked out, it's firing those bad signals up into the brain, and it looks something like this. So there's this connection, deep connection in the brain stem. Here's the brain stem. Here's C1, C2, and C3 nerve roots that go up into the brain stem, fire up and into the tongue, and they make that tongue go. So when that tongue gets affected, it locks over, and there's pain at the same time in the back of the head. When those two things, it has to be those two things together, and you'll have like a headache presentation. That's neck-tongue syndrome. And so in this paper here, neck-tongue syndrome, they report on this patient that has a full resolution after, I believe, three months of care. And so if that's something that someone is struggling with, or you yourself are struggling with, finding out more, getting checked out by an upper cervical chiropractic specialist that focuses on balancing that upper neck can help reduce that misalignment up there that will then release that nerve tension and allow the nerves between the brain and the body to balance, and that neck tongue relationship to balance back out. So neck-tongue syndrome, if you haven't heard of it, now you have, and upper cervical chiropractic care can help with that. So if you have questions, give our office a call, Arete Chiropractic in Portsmouth, New Hampshire, and have a great day, everybody. Take care.